Okay, good day everyone. So this is the rationalization of your recent quiz. So for question number one, the question is asking if you are going to administer a competitive antagonist, what will be its expected effect? And the answer of that is letter B. You have to remember that a competitive antagonist is able to bind to the receptor. It has affinity to the receptor, but it does not produce any effect. So to describe that process, the answer here would be letter B. It binds to the receptor, yet it maintains the intrinsic activity of the receptor. So that's letter B. Number two, according to Fick's diffusion equation, the rate of transport of a drug by passive diffusion is inversely proportional to the membrane thickness. And that is why in the actual formula, the membrane thickness is a denominator. Question number three. Select the statement that correctly describes the process of drug development. So here, sorry, this is actually incorrect. So let me remove the highlight here. So it should be none. Phase 1 determines the safety of the new drug molecule. That's correct. So each choice here with phase 1 can be correct. Therefore, letter B and letter D are already wrong. Statement number 2, phase 3 compares the new molecule to a standard. That can be correct or incorrect. So let's check first. Statement 3, phase 2 is usually performed in a controlled environment. That is correct. So all of clinical trials are usually performed in controlled environments. So any choice with statement 1 or 3 are correct. So either that's A and E. So here the answer is letter E, because it is the only choice which contains both statements 1 and 3. So the answer here is letter E. When you perform a clinical trial, all environments should be controlled as much as possible. Number 4, which of the following would probably not be included in a phase 3 trial of a new analgesic drug? So the best answer here would be choice E, because you cannot really proceed to phase 3 clinical trial without an FDA. So once you have already reached phase 3, you really don't need an FDA anymore, because it is imperative that even before performance of phase 1, you have an NDA application. So a negative control can be included, a positive control can be included, a double-blind methodology can be used, and up to 5,000 patients or subjects can be included. Number 5, which is pregnancy category B? That's metformin. So pregnancy category B means the drug is safe in human subjects, and there are inadequate studies in animals to determine the safety during pregnancy. But because it is already deemed safe in human pregnant subjects, then that will qualify the drug as category B. So metformin is like that. Metformin, right now, the studies are telling us that it is even safe for patients who are pregnant with gestational diabetes mellitus. Before, in the years past, for the treatment of gestational diabetes mellitus, we only consider insulin as the therapy. But right now, they're saying that you can use metformin as a treatment for GDM. Number 6, so botulinum is a large protein. Which one of the following processes is best suited for the absorption or permeation of very large proteins into cells, and that is by endocytosis? So number 7, which of the following drugs is eliminated at a constant fraction per unit time? So that is describing first order kinetics. So the answer here is metformin. All the rest, warfarin, aspirin, and ethanol, they are eliminated by zero order kinetics. So that means that a constant amount is being eliminated per unit time, not a fraction. Number 8, which of the following possesses both affinity and intrinsic activity, and that describes an agonist? Next, you have a drug, chloropropamide, which is sulfonylurea. It stimulates the pancreas to release insulin, and it is a weak acid with a pKa of 5, meaning it starts to ionize at an environmental pH of 5. So here you have the features saying to you that there might be shock due to insulin, excessive insulin, and that is the effect of your chloropropamide. Which of the following will describe the correct management of the overdose? So the answer is urinary excretion would be accelerated by alkalinizing the urine. So the effect of that is by making the urine pH alkaline, you will be converting the chloropropamide into an ionic form, which would prevent its reabsorption by the kidney tubules and therefore facilitate its elimination through the urine. Number 10, which of the following is an enzyme inducer? The answer there is rifampicin, meaning if you give rifampicin to a patient, the CYP450 enzyme system will increase in amount and activity, and that will make the elimination of drugs and other substances by these enzymes quicker. Number 11, somatostatin, which is an antagonist of growth hormone, interacts with the cytokine receptors JAK-STAT system. So that's the Janus kinase signal transducer and activator of transcription system. So what's unique here is that growth hormone as well as somatostatin together with the interleukins, they utilize this form of secondary messenger system, the JAK-STAT system. Epinephrine interacts with GPCRs, particularly the GS subtype of protein, which increases the activity of protein kinase A by increasing the levels of cyclic adenosine monophosphate. Insulin interacts with RTKs, receptor tyrosine kinase. So what happens there is when insulin binds to its receptor, the tyrosine amino acid part of the receptor will be phosphorylated. So once it is phosphorylated, that in turn will activate tyrosine kinases intracellularly, and that will allow phosphorylation of a lot of intracellular proteins. Number 14, thyroid hormone uniquely has an intranuclear receptor even if it is an amino acid hormone. So the answer here is letter E. And then what type of protein is targeted by digitalis? So the digitalis glycosides again will inhibit sodium potassium ATPase pump. That means it will inhibit a transporter. Remember that the function of the pump is to eliminate 3 sodium ions from intracellular into extracellular, and that is coupled with the pumping of 2 potassium ions intracellularly. And number 16, this is the definition of potency. That is the median dose, or the dose that produces 1/2 of the maximum effect. That's your potency.